I have some stuff in my mouth. Okay. Okay, thank you. Good morning and welcome to this public briefing of the Standing Committee on Social Development. My name is Jane Wayallen, and I am the MLA for Montfi-Clichy Region, Chair of the Standing Committee on Social Development. I will now ask the members in the room to introduce themselves for the record and to those online. So I'll start with Kieran.
Thank you, Madam Chair. Kieran Tester, member for Range Lake.
Julian Morse, member for Frame Lake.
Good morning. Shauna Morgan, member for Yellowknife North.
Good morning. I'm Cheryl Yaklaya, I'm member for the Decho.
Ms. Reed?
Good morning. Thank you, Madam Chair. Good morning, Kate Reed, member for Great Slave.
Okay. Thank you, members. Today we will receive a briefing on the Healthcare System Sustainability Unit with Premier Simpson. Please note this meeting is being live streamed to the Assembly's social media channels. I would like to remind all members and witnesses to direct all questions and comments to myself as chair and to wait to be recognized before speaking to help us have a smooth meeting. I will now pass it to Premier Simpson. Please proceed with your presentation.
Thank you, Madam Chair. Thank you for inviting us here today to brief committee, members of the public on the Healthcare System Sustainability Unit's progress and next steps. Today, I am joined by Terence Coutre, the Associate Deputy Minister of the Healthcare System Sustainability Unit within the Department of Executive and Indigenous Affairs, Jennifer Young, the Executive Director of the Healthcare System Sustainability Unit, and Kyla Cackwee-Scott, my Chief of Staff, as well as online is Frederic Bergeron, my Ministerial Special Advisor. As you're aware, this unit was created last year to help us get a handle on our healthcare expenditures and services. This includes determining what are core health and social service programs. Defining what should be core requires an analytical approach, which the Sustainability Unit has outlined in its monitoring and evaluation plan that has been previously provided to committee. In addition to outlining the analytical approach, the monitoring and evaluation plan also outlines how the unit will achieve its activities and associated outcomes, and how it will measure success over time. Since our last update, the Sustainability Unit continues to make progress and is currently finalizing its preliminary analysis of programs and services before moving forward with the next phase of the work. This next phase will include a deeper dive into prioritized programs and services to identify areas where operational efficiency and fiscal sustainability can be improved. While the Sustainability Unit's work has a role in ensuring quality care for NWT residents, it is important to note that this work requires careful collaboration with other sustainability initiatives under the Minister of Health and Social Services, as well as the Health and Social Services authorities. Minister Semler and I continue to work closely on these initiatives, and I look forward to providing more progress reports for this unit as work continues. And with your permission, Madam Chair, I would ask Mr. Coutre to provide a detailed detailed update on the unit's work. Thank you.
Yes, please proceed.
Thank you, Madam Chair, and good morning, members. Thank you once again for the invitation to provide an update on the Healthcare System Sustainability Unit and the work that we're doing. I'll try to move through these slides quickly, but want to cover the broad areas that are highlighted on slide number 2. In terms of background, members will recall that our unit obtained funding in October of 2024, and we've been working to stand this unit up as quickly as possible. Part of this work includes developing a monitoring and evaluation framework, which really anchors the work that we'll be doing in the coming months. In addition, we'll provide an update on staffing, development of an inventory of programs and services, as well as the work that we've done with stakeholder engagement. And finally, I'll outline next steps, including a closer examination of how we plan to embark on the next phase of work, and to update committee on the work that we're doing to analyze the potential migration of the Hay River Health and Social Services Authority into the GNWT. Next slide. As the Premier mentioned in his opening remarks, the unit's approach to evaluating healthcare sustainability is outlined in our monitoring and evaluation framework. This framework uses a project management approach whereby the results of one phase will inform the work in subsequent phases. Current work focuses on validating and analyzing current inventory of health and social services programs offered in the Northwest Territories. This initial step is important as it provides us with a better understanding of what is currently offered, but also a foundation of prioritizing those programs or services for further evaluation in the next phase of our work, which is really to identify a suite of health and social services programs that should be core to the Northwest Territories. The framework also uses a logic model and associated performance management plan that illustrates both how the unit intends to achieve our desired results, but also how it intends to measure progress and success. This logic model is illustrated on the next slide, slide number 4. Thanks. The logic model is really just a visual representation of our work plan and provides us with a bit of a roadmap of how this work will be performed. There are 5 major activities that outlines the work that we are undertaking. Those activities are highlighted in that second column with the blue header. The first activity is to develop a monitoring and evaluation framework, which of course is now done. But then it leads on to other activities such as establishing an inventory of current health and social services programs. This is the current focus of the work our unit is undertaking right now. Later, we will, the next phase of work will work towards defining a suite of services or programs that should be core to the Northwest Territories, as well as enhancing accountability and our budgeting and operational processes. And lastly, develop a continuous monitoring and improvement plan for future years. Next slide. In terms of an update, we've made significant progress across several fronts. The first relates to staffing and filling the remaining positions for our unit. I'm happy to report that we've onboarded 7 of the 8 positions originally planned for 24-25, and we'll proceed with recruiting for the remaining 2 positions in this current fiscal year. Once those positions are filled, our total staffing complement will be a total of 9 positions. We've also made substantial progress on developing and validating an inventory of current health and social services programs. As mentioned, this inventory is critical to informing the next phase of our work. To develop this inventory, our team has reviewed data from a number of different sources, including departmental main estimates, business plans, variance reports, and other government submissions related to health and social services. We've also used interview findings from over 40 different engagement sessions with program staff from across the health system. These engagement sessions also included external stakeholders such as the College and Association of Nurses for the Northwest Territories, as well as the Northwest Territories Medical Association. And although our first milestone of work is almost complete, the engagement with stakeholders is not expected to end. That will be an important part of our work going forward. Next slide. I'm on slide number 6 now, Madam Chair. The current focus of our unit is the development of our preliminary analysis of the programs and services identified in that inventory that we mentioned earlier. This is really the first milestone of our project and is mentioned to inform our next steps of work. In developing this inventory, we're looking at what the current suite of health and social services programs are that are currently being delivered, as well as the legislative or policy basis for those programs and services, as well as how those programs are currently being funded. Answering these questions will help us understand if there are any operational or financial efficiencies to explore. Although not immediately, this work is expected to help us understand the reach of those programs or services and the utilization of those programs and services. In terms of next steps, our preliminary analysis will be completed in a few weeks. The results of this work will be used to initiate the next phase of work. This work will identify where sustainability and efficiency can be improved and ultimately identify a proposed suite of services that should be core to the NWT. In addition to these activities, our unit remains committed to regular communication with stakeholders. Madam Chair, this includes regular updates through our website, which is now live. This website will include details such as the details of this update, employee newsletters, and a plain language version of our monitoring and evaluation framework. In addition to these tools, we will continue to engage with frontline staff, stakeholder groups, to support future efforts in this initiative. Next slide. Thanks. Finally, Madam Chair, in addition to the work that we've undertaken to define core programs and services, the Sustainability Unit has also undertaken work to analyze the possibility of migrating the Hay River Health and Social Services Authority into the GNWT. This work just started a couple months ago in February and involves calculating the cost implications to the GNWT and analyzing the logistics of implementing this change. I think this was last looked at in 2015, and the timing of that amalgamation didn't work out. So this analysis is really just resetting the work that was previously completed to reflect current day markets and current day costs. The first step of this work is to develop those options for consideration, which we are expecting to be completed later this fall in this fiscal year. Thank you, Madam Chair. That's the short presentation. I'll turn it back to you and the Premier.
Okay. Thank you. Thank you for the presentation. I will now ask the member if they have any questions. MLA Morgan.
Thank you, Madam Chair, and thank you for taking the time to be with us today to have this public update. So, I mean, we just heard from the Medical Association, which was raising some fairly significant alarm bells in terms of the scale of the potential crisis that we're facing in the healthcare system and the sort of real consequences of services shutting down. Emergency room could shut down, like major things that could impact residents. And I think many people will be wondering, how can the work of this unit respond in a timely way to sort of the level of challenges and crisis that we're facing? I mean, just to give some context too, I mean, there have been numerous initiatives over the years that have attempted to deal with healthcare sustainability. We had a system sustainability office set up in 2020 within the Health Authority. There was a deficit reduction plan that the Leadership Council was supposed to produce in 2023. So this is not the first iteration. And so I guess my question is, what can you show us or tell us that will be different about this initiative, and how will it respond to the urgency of the crisis that we're looking at in the healthcare system? Thanks.
Okay, Premier?
Thank you for that. And there are issues currently in the healthcare system that need to be addressed, and people are actively working to address that. There's also the long-term sustainability of the healthcare system. We amalgamated a number of different healthcare authorities into a single authority, and it was a bit of an experiment. Whenever these amalgamations happen, you need to be able to follow the progress on that amalgamation and ensure that it's happening appropriately, and that has not been the case to date. And so the reason this unit was put together was to really get a handle on the healthcare system, the expenditures, the services being provided, and so that those can then be turned into recommendations, or at least information for decision makers, so that we can understand what we're working with. That being said, there's, so that's more of the long-term goal, but we're well aware that there are near-term issues and immediate issues, and so maybe I can get Mr. Coutre to speak about their take on that. Thank you.
Okay, Mr. Coutre?
Thank you, Madam Chair. I think there's, in unpackaging the question, which is a really good one, there's going to be areas related to sustainability that immediately impact the frontline delivery of the operations of those programs and services in the short term. And then there's going to be efforts that we do to ensure sustainability in the long term. And I think the work that we're doing is more of the latter. So we want to take a system-wide approach to looking at everything that we deliver and ensuring that it's going to meet a suite of services that we want to deliver in the Northwest Territories, and making sure that we're delivering those services well. As we get into the evaluation of those programs and services, undoubtedly, we're going to come across operational opportunities for us to improve how those services are delivered in the short term. And we're going to be working with our project team to make sure that we're collaborating as a unit to ensure that those opportunities are addressed. And so, Madam Chair, the project team that we have that oversees the work that we're doing, it includes all the CEOs from the 3 authorities. It includes the deputy head and her senior management team from the Department of Health and Social Services, and it includes our team. And that's the format of our structure, our project structure that we develop to ensure that we are collaborating on those opportunities. Thank you.
Thank you. MLA Morgan, do you have a follow-up question?
Yeah, thanks for that. So I think it was back in January, an update was shared with us, but it had like a monitoring and evaluation plan, and it had timelines attached to various phases. And I didn't see any timelines specifically in your presentation this morning. The timing of the phases and what will be accomplished by various dates, is that still the same? Is your plan still the same, or has the timing of your phases or your approach changed at all, especially given the urgency of the challenges? Has it changed at all since January of this year? Thank you, Madam Chair.
Okay. Mr. Coudray.
Thank you, Madam Chair. One of the things that we've added to our work plan from the original framework that was developed prior to Christmas was we added a preliminary analysis to the core suite of programs and services that we're currently developing, and that piece of work is really the first milestone or the first deliverable that we're working towards, and we're almost there. We're literally just a few weeks away from finalizing that work. And I suspect MLAs will be seeing that as part of our next update, which we committed to coming back to this committee every 6 months with a progress update, Madam Chair. So from that perspective, the original timeline that was presented to members is still on track. Once we get into the deeper dive or the program evaluation work for each program, that's really going to be the heavy lifting work that we need to do for each of those programs. And they're not all equal, and they're going to move at different paces. So some will be wrapped up sooner, some will be wrapped up maybe not so soon, or it'll take a little bit more time to get through all the material, depending on the size of the program and the complexity. But that's something that we track weekly through a dashboard that we monitor very closely, and those timelines are, we're sensitive to that, and we certainly appreciate the urgency for us to put out some of this work, so we have that at top of mind as well. Thank you.
Thank you. Thank you. MLA to start, you have a question?
Yes, thank you. So I guess the Premier's comments about the amalgamation of the authorities is a kind of an experiment. I think at the time, it certainly was pitched as a transformed, I think I pulled up an old press release from the Minister of the Day, and it was quote, a monumental change in improving the healthcare in the Northwest Territories. So at the time, I think it was seen as correcting a lot of deficiencies, especially around operational efficiency, because there were the different authorities. And now perhaps we didn't see those savings. So I'm wondering if, and improved care at the end of the day. I think the slogan was best care or better care. So if that didn't happen, is that part of this work as well, to do a proofing of that concept? Is potentially the outcome of this work moving away from the NTHSSA model to something else, whether it be a health agency model like we have in some other provinces, or whether it's returning it back to a regional-based model of management. I'm just wondering where this work is going to take us on that level, or if we're just looking at numbers and insured benefit and insured programs and benefits and services, because that seems to be a much larger discussion. But I'm interested if that's part of the work the unit's doing. Thank you.
Okay, thank you. Premier Simpson?
Thank you, yeah. And so the amalgamation, I guess, it wasn't necessarily an experiment, but it was untested. When you try to create a new organization of that size, there's going to be hiccups along the way. And, we're trying to iron those out to really get a handle on how things have unfolded and make sure that we can course correct where necessary. And if things are working well, then that's great. We want to ensure that continues. And when we look at, Hay River Health Authority, we talked about looking at how that could be brought into the NT Health Authority. And that's because we do see the benefits of the amalgamation. We do see those economies of scale and the value in cooperation. And so, I'm not expecting that we're going to break up the entire health authority, the health authority, but that's part of a larger conversation. So this is more the technical behind the scenes type of work that's happening. But, the future of the health authority is much broader than that and would involve obviously the health authority, the Minister of Health, the members of the Assembly. And so that's a little beyond the scope of what we're looking at here. Thank you.
Thank you. MLA Testart, do you have a follow-up?
Yeah, thank you, Madam Chair, and thank you to the Premier for that. I think that's I think the frustrating piece is we have three, as much as it's good to have three different units that are well-resourced to do this work, or three different processes, because we have this work, we have the work of the public administrator, and what other process am I missing? Anyway, let's just stay focused on what we're doing today. But the interaction between all this work that's been doing on system-wide analysis and reform is really important, because that's ultimately how we're going to solve some of these problems. What's missing, I think, or the most important piece of this in both reducing costs and improving care is, I think, more the work of the public administrator than the sustainability piece. But as we're here discussing this today, what does long-term sustainability for the healthcare system really mean? Because I think, there's the fiscal needs of government and what the kind of carrying capacity of a public government has to support healthcare benefits, and that's challenged across Canada. We know that. But so I think when people are worried, or when people think about this idea of long-term sustainability and try to figure it out, a lot of fear comes into it. Does that mean certain benefits and certain programs are going to be cut? Does it mean jobs are going to be cut? Does it mean we're going to stop doing locum programs because they've been unfilled for years, even though they're specialist positions, and we're just not going to offer those specialties in the Northwest Territories? So, and we have metaphors of cars and things like that to try to square this, but what does it really mean in how we provide health care to residents? Not how we pay for health care as a government, but what does a sustainable system mean in terms of real health care delivery for the people we serve? Thank you, Madam Chair.
Thank you. Premier?
Yeah.
Okay.
Yeah, thank you. And so one of the priorities of this assembly is improving access to basic health care. And so that's really what I've been focused on, is ensuring that if you need to go see a physician, or you need to see a medical professional for a medical issue, that you will have that access. I just got an email this morning about the status of physicians in Hay River, and I look forward to a time in the future where we don't get those types of updates anymore. So what I would like is for residents to be able to access the health care they need. And if we don't have those services available in the territory, to be able to go elsewhere and access those. Right now, not every resident gets everything they want out of the healthcare system. And so as we have changes, there might be things that some residents are getting now they might not get in the future. There might be some things residents don't get now that they're getting in the future. We really need to do this work and figure out what is being delivered, who's delivering it, how it's being delivered, whether or not there's value for money, whether it makes sense to send people south for certain things, or change how we do things and keep people here for certain things. So really, there's a lot of room for improvement, and ultimately what that looks like at the end of the day, my goal is better access to basic healthcare services for all residents in the territory. Thank you.
Okay. Thank you, Premier. Okay, I have Ms. Reid. Ms. Reid?
Yes, thank you, Madam Chair, and thank you to MLA Tester, because this dovetails into my question really nicely. So I did go back and look at the monitoring and evaluation framework that was shared with members. I'm pleased to hear there will be a plain language update for the public to review that in short order online. And I went through the metrics and criteria of how you're helping, or how you're starting to evaluate and prioritize programs and services. So some of these things are what's core, what's required by legislation, what's comparable to other jurisdictions, what's the cost, et cetera, et cetera. And the Premier just spoke a little bit about medical travel and sending residents out for services that are not core, that are still required in their situation. So I guess my question is, what will help us prioritize what is actually a service that can't be delivered in the NWT due to perhaps lack of intensity of requirements by residents, but are still very much needed? How will you prioritize what is going to continue with medical travel? Thank you, Madam Chair.
Okay, Premier?
Thank you. And so there's a lot of work to be done before we start making those types of decisions, but perhaps Mr. Coutre can speak to that. Thank you.
Okay, Mr. Coutre?
Thanks, Madam Chair. Thanks, Madam Chair. I think it's a good question, and the way we've structured this initiative is to take that program evaluative approach, and gathering that data and evidence to inform that conversation is going to be an important part of that step in achieving what the member's asking about. The preliminary analysis that we are very close to completing right now will provide us a better understanding of what's currently provided. So that's not jumping to any conclusions yet, or it's not jumping to anything to suggest, what should we offer differently versus other programs. It's just really a better understanding of what we currently deliver. And then the next step of that will be to prioritize our work and do a deeper dive into those programs and services. We need to get to them all. It'll be a challenge to get to them all, but we're going to have to prioritize that work given the size of our unit and the resources available. But again, we appreciate the urgency to try to pull this stuff together as quickly as possible, which we'll work to do. But it's really that prioritization of program evaluation work that we're going to undertake for each of those programs that's going to help inform that conversation for next steps. Thank you.
MLA Reid, do you have follow-up questions?
Yes, I do. Thank you, Madam Chair. And so thank you for bringing up the urgency of this work and trying to do it both responsibly and under the gun, so to speak. I think you feel the urgency from all the members who are present today. Can the minister the Premier please tell me if that work that will happen, I assume, in phase 2, is that still on the timeline that has been shared with members in the monitoring and evaluation framework, at least at this point? Thank you.
Okay. Premier Simpson?
Yes, it is. Thank you.
Okay, thank you. I don't have any other, okay. So we have, okay, I'll go to MLA Morse.
Thanks. I have a number of questions, but I guess the first one, this new initiative that's been identified to bring Hay River under the NTHSSA, I'm kind of curious, can you give us a bit more background as to kind of how that came about, why it's being considered as an option, sort of give us just a quick summary of the rationale for why that would be a good idea? That's my first question.
Premier Simpson?
Sure, thank you. So back when the authorities were amalgamated, the idea was to include the Hay River Health and Social Services Authority in the Northwest Territories Health and Social Services Authority. From what I understand, there were cost implications to that I guess were not acceptable to the government of the day, and related to pensions and things like that. So it's unfinished business essentially, and there's a bit of a disconnect. You know, the Hay River Health Authority and the NT Health Authority do work together, but there's still a bit of a disconnect there, and I think that it would, there's opportunities to better support patients and better support the region through an amalgamation. Right now, I think communities like Fort Resolution are served out of Yellowknife. You know, Hay River is just down the road, and it doesn't quite make perfect sense to have that system, and so we want to examine this option. This was mandated to the Minister of Health and Social Services. It was in her mandate letter to examine this, because we have this new unit now, which has this, so we have some additional capacity. That responsibility has been given to this unit to do. Thank you.
Thank you. Mr. Morris, do you have a follow-up question?
I have a number. So I'll start with this one, and there will be follow-up questions, but let's go one at a time. So my understanding from looking into the background of this a little bit is, of course, there was a system sustainability plan developed in 2020 and described as a multi-year plan to address the financial challenges facing the health and social services system. Part of that work and the System Sustainability Steering Committee, which I assume has kind of been turned into this unit, I think, they had a report done on governance and corporate structure by MNP. I note that is now publicly available on the Health and Social Services website, or NTHSSA website. There's a number of recommendations from MNP on corporate structure, governance. So is this sustainability unit responsible for implementation of the MNP report? And can you help us understand how this unit relates to the system sustainability review that was done in 2020? I'm kind of curious if everything that sustainability review recommended has been implemented, or how does it all roll together? Because it feels like it seems from looking at the background that we're redoing an exercise, and it leads me to wonder, well, why did the previous exercise not really work? And what are we doing with the recommendations that, you know, the MNP report cost us about $600,000. It was quite an expensive endeavor and had a bunch of recommendations that I don't think we've implemented yet necessarily. And so I'm curious about previous work that's been done and where we're at with that, and how that relates to the work that's being done by the new HSSU. So I guess that was a number of questions, but.
Okay, thank you. Mr. Coudray?
Thank you, Madam Chair. I'm vaguely familiar from previous lives of the 2020 sustainability plan and also the two MNP reports that were previously commissioned. I think it's worth noting that right up front that this unit isn't necessarily charged with implementing the recommendations of those reports done by MNP. It's a little bit outside of the scope of the work that we're doing. Yeah, so I think, you know, from the 2020 sustainability report that was done a few years back, we're really just picking that work up now. And in one of the messages that we had earlier when we met with MLAs last time was we really don't want to redo reports or redo work that was previously done. So we're using those sources as resources for the work that we're doing now to help inform this preliminary analysis and then the deeper dive into the program review that we're going to be doing as part of phase 2 of our work.
Thank you. Mr. Morris, do you have a follow-up? Another?
Yeah, thank you. I appreciate the chair's indulgence on this. So knowing that, you know, a bunch of work was already done, we have a report that came out of part of that work from MNP. it leads me to believe that maybe there's some low-hanging fruit that can be grasped here, because I think, you know, the general frustration we hear, you know, all the time, and we just had a briefing with the NWT Medical Association, is just how slowly things can move through a complex system like the NTHSSA and HSS. So can we not simply take recommendations that have come out of previous work, like the recommendations that are in the MMP report, and just get to work getting those in place? And maybe to broaden the question a little bit, like, have you identified some low-hanging fruit that we can start to work on, as opposed to waiting until the end of, you know, 2027 or years from now to start implementing recommendations, considering this work has already been ongoing as far back as 2020? Thanks.
Okay, Premier Simpson?
Thank you. So the work of this unit is not the implementation. It is an examination of the healthcare system. And I'm not sure if a Deputy Minister has any more information to add to that, but I'd like to pass it to him. Thanks.
Mr. Coutre?
Yeah, thanks, Madam Chair. And just to add to the Premier, he's absolutely correct. And we certainly don't want to overstep our scope in terms of getting involved in operational decisions or changing operational formats of how those programs are delivered. And back to an earlier comment where we have structured a project team around the work that we're doing to review the material that we produce, to roll that out in a more of a informed basis based on data and evidence on what programs should be core to the Northwest Territories. So from that perspective, I think as we get into the detail, we might see some quick wins, or we might see some things that could be implemented faster. But again, Madam Chair, I want to remind members, like some of the timelines for the work that we're doing in those programs and services are going to be at different tracks. Some are going to happen faster, some are going to take a little bit more time. So I don't want to overpromise to say that we're going to have a bunch of quick wins, but we expect that there's certainly going to be conversations that we can bring back to the project team and collaborate on those fronts. Thanks.
Okay, thank you. We have going to do second set of questions. So starting with MLA Morgan. Oh, you have, okay, we'll go to Cheryl, to MLA Akilaya first.
Thank you, and thank you for your presentation. My question is, when do you expect your recommendations to have an effect on the healthcare for Northerners? Thank you.
Okay, Premier Simpson?
I'll hand it to Mr. Coutre.
Okay, Mr. Coutre?
Thanks, Madam Chair. I think the first milestone of work that we're looking at doing, that preliminary analysis, we should have in front of MLAs in the July timeframe, and then we are going to kickstart the next phase of our work immediately after that. And then we'll be in front of members every 6 months to provide progress updates. And depending on how progress tracks with those detailed reviews of the programs and services will determine when those recommendations could be put forward. So we're here for a couple of years. Our target is to try to wrap things up as much as we can by the end of this government. So we're going to be working to that. We feel the urgency to get some of this work out as quickly as possible, but we also want to try to balance that with making sure that we have all the data and the evidence to inform that conversation and to support those decisions.
Thank you. MLA Akilaya, do you have a follow-up question?
Yes, I do. Thank you, Madam Chair. How are, I guess I'm just asking direct questions. How are frontline workers being addressed in this healthcare sustainability unit? How are their concerns, or how are they being addressed? Are they a stakeholder? Do they have a say in how this is working out? Thank you.
Premier Simpson?
Thank you. Yeah. And again, this is information gathering and analysis. And the team has been meeting with healthcare professionals at all different levels, different associations, frontline staff. Maybe the Deputy Minister can speak a bit about the engagement that's happened so far, specifically with the frontline staff.
Okay, thank you. Mr. Kuche?
Thank you, Madam Chair. So we've managed to meet with every ADM and executive director for every program area within the health system. We were able to connect with all the public administrators, whether it be through NTHSSA, Hay River, also with department heads at the Department of Health. And then we've also went down into that hierarchy, one layer, to talk to frontline managers and program staff to get their input into the work that we're doing. And through the Premier, Madam Chair, maybe I'll ask Ms. Young to add a little bit of detail about how we collected that data. There was a bit of a structured approach in how we approached that. If I can ask that, please, ma'am.
Ms. Young?
Thank you, Madam Chair. In terms of developing our program inventory, we did meet collectively with members from the system per the categories in the health and social services system. So as an example, in public health, we met with members collectively from the department and the 3 authorities in a singular meeting so that we could obtain consensus, if you will, in terms of what the suite of programs and services are that we're currently delivering as a system. So we're continuing to validate it through that process. In addition, we do have indicators built into the monitoring and evaluation framework to seek engagement from frontline staff on a continual basis to answer some of those questions we have in there. And we also have open feedback available through newsletters that we produce into the system every month. And through that newsletter, we do identify an email address for people to reach out to us as well. Thank you, Madam Chair.
Okay, thank you. Thank you. We'll go to Ms., I think, MLA Morgan. I think
Okay, thank you, Madam Chair. So the timeline of your phases that was laid out in the monitoring and evaluation plan had the date August 2026, so August of next year, as the time when phase 2 was supposed to start. And phase 2 is the time, according to the plan, when you would actually start evaluating how you can improve the core services and programs that we have. My impression was up to then, it's mainly just understanding what in fact we do have, just sort of focusing on the inventory. And so in my mind, that some of the core services, I would assume, include, primary care, emergency care. And so my impression is, according to the timeline, that it wouldn't be till August of 2026, so next year, that we would even, this unit would even start thinking about how can those absolutely critical aspects of our healthcare system be made more efficient? How could they be more improved? How could we ensure better access to care? And yet, at the same time, we have a public administrator who I believe is being tasked with trying to balance the budget this year, within the next 3 months. So we're going to see, need for finding some efficiencies and so. But I'm wondering how the two dovetail, because I'm worried that if we have tasked someone with trying to find those efficiencies and balance the budget now, they're going to start making cuts or identifying things that we won't even know until years later the why, or if we're waiting until August 2026 to start evaluating what actually needs to be improved in those things, we're sort of doing it backwards. So how can your work, or does your work, feed into the work or decisions that are facing our public administrator and our minister and the authorities now in terms of trying to balance the budget? And are you concerned that we would be, making cuts now without the benefit of the analysis that your unit is supposed to be there for. Thank you, Madam Chair.
Mr. Coudray?
Thanks, Madam Chair. I think the next phase of our work, or maybe what we're calling phase 2, is probably going to happen a bit sooner. We're looking at taking on some of that work as early as later this summer or early fall, and then continuing with that work through to August 26 and maybe even later than that. The monitoring and evaluation framework and the timeline that's part of that document is certainly going to has to be iterative, and we're going to need to be flexible on some of the timelines highlighted in there, and that's going to be part of the work that we do with our project team and collaborating with the PA and NTHSSA and the other authorities to make sure that they understand and they're seeing some of the results of our work as we progress. We meet with that project team monthly, so we're in constant contact with them, and we're giving them the feedback and the results of our work and having those conversations on a regular basis so that they are using it for all the other sustainability initiatives that might be going on in other areas of the health system, whether it's being performed by the department or whether it's being performed by one of the authorities. Thank you, Madam Chair.
Thank you. MLA Morgan, do you have a follow-up?
Thank you for clarifying that. That was sort of what I was getting at with an earlier question about whether the timelines are still in place. And so that was why the previous answer was confusing. But it does sound like some of the work is being sped up or happening before August 2026. So that's good to clarify. On the topic of the work and analyzing the amalgamation of the Hay River Health and Social Services Authority, you mentioned how that currently impacts patient care and things are being done that don't necessarily make sense or work the best way for the system or for patients. But I think it's also worth highlighting the impact on staff as well, that you have staff working for the, frontline practitioners working for the Hay River Health and Social Services Authority that don't necessarily have the same wages or benefits or agreement as staff working in other parts of the territory, which, doesn't make sense, and it creates inequities amongst practitioners when they can look at someone else who has a different kind of arrangement in their work, and also barriers when I'm sure you have staff in Hay River that might locum or work in other communities in the territory and can't easily just sort of cross over and work in the next community because it's a whole different health authority, and we want to reduce the barriers to those kinds of things. So I certainly see benefits of this kind of amalgamation. Do you have a timeline on that, or do you have even a sense of when steps would be taken or possible decisions would be taken, even if you don't, I understand if you can't say right now, okay, we're going to amalgamate by this date or something, but can you give us a sense of the timeline of various steps in that decision-making? Thank you, Madam Chair.
Okay. Premier Simpson?
Thank you. One of the big issues, of course, is that the monetary issue. And so by this fall, we should have a good handle on what the costs of an amalgamation would be, and that would then determine next steps. So if it's something that is feasible, then we have to look at the current situation of the healthcare system of the world, really. In my 5 years of being a member of government, no year has gone by without a major crisis or something completely unexpected. So while I'd like to say that we know when we're going to get things done by, the fact is that we should have the information later this year, then that will inform next steps. Thank you.
Okay, thank you. Thank you, Premier. MLA Testar, do you have a question?
Thank you. Yeah, I think that issue's been a long-standing one, so I'm glad to see it make the agenda. So we've done something similar, I wasn't here, but I understand the 19th Assembly did something similar with the Government Renewal Initiative to take an inventory of all the programs and services the GNWT offers, and then use that as a tool to find efficiencies and sustainability. At least that was the intention. And then now it's kind of become a budgeting tool. So what was kind of at first pitched to be this kind of sweeping efficiency change that was going to result in a leaner, meaner government that that trims the fat and ultimately delivers better services to the public, again, has become more of a planning tool. So what assurances can you give us that the work of this sustainability unit is not going to end up the same way GRI did? Still a useful tool, but it's not a transformative process that's being sold to the public right now. That's a solution to our healthcare crisis. Thank you, Madam Chair.
Okay. Premier?
Thank you. My hope for this unit is that because it's a much smaller focus. When we talk about all of government, that's big. And so, we're looking at even experiencing issues with integrated service delivery, and that's why we're focusing on a single area first to implement that, because it's tough to do a whole of government approach to something right off the bat. So I'm hopeful that this will be more effective, but Ms. Young can add to that answer. Thank you.
Okay. Ms. Young?
Yes, to add to what the Premier was saying, this is different than GRI in the sense that it is a more focused effort to do, and we're less focused on the outcomes and quality of care and more on the efficiencies and fiscal sustainability. So we have more of a focused effort here with the work that we're doing. Thank you, Madam Chair.
Okay, thank you. Okay, next person. Excuse me. MLA Morse.
Thank you. I think that, in response to my last question, what was said is that, it's not their intent to duplicate work that's already been done, but also that implementation isn't the function of the unit, which of the healthcare sustainability unit, which leads us right back around in a circle, back to the work that was already done and why it hasn't been implemented yet. So just knowing that, we have the MMP report, as we discussed a bit earlier today, but you folks weren't in the room for, we have the physician workforce plan. There's a number of recommendations that have been made along the way that weren't implemented. So it really seems to me, and I think this is actually quite a widespread problem that I see in government quite often, not just this government, is that there's a huge amount of work put into studies. The studies come out. There seems to be, at that point, hand-wringing about making a decision as recommended. And so the study gets shelved and we go back into the cycle of studying and studying and studying. And I'm a little bit worried that we are engaging in a process like that here again. Because it doesn't seem to me, like we've done assessment, we've brought in consultants, we've spent a fair bit of money and a fair bit of time doing an assessment of system sustainability and have not managed to implement all of the recommendations that came out of that assessment. So the fear that I have is that we do yet another assessment, and if we haven't solved the why aren't things being implemented problem, we're going to end up in the exact same place we're in now, which is that we've got all these recommendations that are that potentially could create some good. They're not being implemented. So I guess it leads me to be curious as to how this unit is going to be different if what we have fundamentally is an implementation problem. So I recognize that this unit is not responsible for the implementation, but it seems to me that we really do need to be focusing on why is implementation failing if this unit is going to be successful. And do we need to maybe take a pause and look at all of the recommendations that have already been made and our success at implementing them, and whether what's needed in this system is piling onto those recommendations with even more. It seems to me that the system doesn't have the capacity as it stands to implement the recommendations they already have. And that could be a fundamental problem that we're not getting at. So I'd be curious to hear from the Premier and about that problem that we've got, just the capacity of the system itself to implement the changes that are being recommended to it.
Okay, Premier?
Thank you, and I share the members' concerns about reports on reports on reports. I don't, appreciate that either. I think that the time of, government officials and employees is best spent advancing work and not just doing reports that are going to be shelved. So when you have things like the MNP report or reports from other bodies, those are, sometimes they don't have the level of insight that is needed in order for us to make decisions. So in the last government, as a minister who was not the Minister of Health, I had a lot of difficulty getting a grip on where money was being spent. Like as a cabinet minister, where was money being spent in the healthcare system? What programs were we offering? Who's paying for these programs? That information was not been readily available. And so we might have recommendations to do something, but we don't have the background information to inform those decisions. That's been my experience. And so the idea behind this unit is to actually get that information so that when we're sitting at the cabinet table and when we're in front of committee, there's answers. And the member said maybe we need a pause and look at all these recommendations and our capacity to implement them. Well, this is the pause. Looking at those recommendations, figuring out do we have the capacity and how can they be implemented if they should be implemented. So this, like as I keep saying, this is an information gathering and analysis effort to inform decision makers. Because if we can't even follow the money, if we don't know where the money is being spent, what it's being spent on, how are we going to be making informed decisions? Thank you.
Okay. MLA Morris, do you have a follow-up?
I do, thank you. And I mean, I guess I am struggling a bit just because I feel like we're kind of going around in circles in this conversation and in this sort of assessment and implementation cycle. I mean, it's not entirely clear to me why. Just to focus on the MMP report itself, it made with rationale, provided a bunch of rationale and information as to why their recommendations would be helpful, engaged with NTHSSA about the recommendations, and made the recommendations. And now we are sitting on them. So it's just not clear to me why implementation is such a problem. And I don't actually think that we need and I'm not suggesting that the work of the Healthcare Sustainability Unit is not needed, but I don't think that we need the Sustainability Unit to review that recommendation and determine how it can be implemented. Like it's there. How to implement it is in the report. So I'm struggling with this. We just need to do more assessment before we can do any major things. And I'm wondering if maybe there probably is work going on and there probably is some implementation happening and maybe the people at this table aren't necessarily the best folks to answer those questions. So there's probably a bit more to this. And this is the difficulty of a system as complex as the healthcare system. There's a lot of work going on and one person can't answer all of these questions. But I would encourage perhaps the best way to ask this question is to maybe suggest that some follow-up happen later on, just describing to us where we're at with the 2020 Healthcare System Sustainability Plan, with implementation of that plan, implementation of the Physician Workforce Plan, and implementation of the MMP report, so that we can get an idea and so the public can see that there is actually implementation happening and that the Healthcare Sustainability Unit is doing new work that will kind of help to improve the system further. I think that would be very helpful for me and the public just to understand that there is progress being made on the work that was already done, as opposed to, we're now in the kind of further assessment phase of assessing work that was already assessed. It feels like a spinning wheel. And I'm not 100% sure that the wheel is spinning. There may actually be good work going on. It's just difficult to put all the pieces together for me right now. So if maybe the Premier could commit to following up with us with a bit of an update as to kind of, here's the work that was originally done, this is how we've gone far in implementation, here's the MMP report, this is where we're at with implementing that, and on top of that, the HSSU is now doing this new work. I think it'll help lay out the path for me as to what's going on. Thanks.
Premier?
Yeah, I can work with the Minister of Health to provide that type of information to committee. And there is work happening, right? The people in the healthcare system want to see improvements in the healthcare system. They're working to make improvements in the healthcare system. A lot of people are run off their feet as well. And the we're doing a lot of different things. Are we doing them effectively? Are we doing them efficiently? If we were, to the extent that we could be, maybe we would have a lot more capacity to implement recommendations. And, I can't speak to, the implementation process in the NT Health Authority, that they don't report to me. But the reason this unit is in the Executive and Indigenous Affairs under the Premier is so that we can ensure that implementation does happen. I recognize that this is a major issue. Access to healthcare in the territory is a major issue. It's a priority for this Assembly, and that's why the Premier's office is dealing with it. Thank you.
Thank you. We still have time for more questions and for another set of questions, but okay. To MLA Morgan.
Thank you, Madam Chair. So going back to the engagement that you've been having with frontline practitioners in particular, it sounds like you have had at least initial meetings with various groups of practitioners or associations representing them. And you've sort of implied that they can have ongoing input. It sounds like the onus would be on them to sort of email you or get in touch if they had thoughts. I don't know if you can clarify that, whether the intention is to have follow-up meetings or sort of ongoing proactive engagements with them, or just sort of like wait to hear from them if they have thoughts. But I also wanted to know whether there is intended to be a feedback loop to show how their input is actively being incorporated, how it's being considered, or if you've decided, okay, no, we're not going to follow that recommendation or suggestion because of this or that. What I'm hearing is that there really is a desperate need and sort of frustration amongst frontline practitioners that they're trying to talk to lots of people. They're trying to talk to their own sort of leadership within the system. They're trying to talk to you. They're trying to talk to the public administrator. They're coming to talk to the committee and not hearing or understanding what's happening now, like what's being done with all these suggestions and recommendations. So I think that feedback loop is super important. And if you do end up disagreeing with the recommendation, at least going back to them and explaining why, okay, this is not feasible because of this or that. But in the absence of that, people just feel like nothing makes a difference. They're trying, they're taking the time out of their busy schedules to speak, and none of it makes any difference. So maybe you can explain a bit more. Thank you.
Premier?
Yep, thank you. And so, as the member mentioned, there is an email address. It's accessible on the website, and anyone in the healthcare system who wants to contribute can contribute through that portal. And again, this is information gathering and analysis. So if there's a recommendation from a frontline practitioner, then that recommendation is considered. It adds to that body of information. It's not something that would then be passed on to cabinet to make a decision on. So this isn't the healthcare system sustainability unit isn't there to implement recommendations that we receive. It is to analyze all of the data that we can gather to inform future recommendations. But the Deputy Minister can add to that response, Madam Chair. Thank you.
Okay. Mr. Coudray?
Thank you, Madam Chair. And just to add to the Premier's response, we anticipate that we'll be using both those modes of communicating and engaging with frontline staff. So we have options for them to access or approach us through a generic email address. But we're also going to go to them continuously as we get into the more detailed evaluation of the programs. So it's going to happen both ways, and that communication is going to happen continuously throughout this initiative. We do have some formal communication documents. We have a communication implementation plan that we have developed to help guide us in this area. And that transparency is an important part of the work that we're doing. And it's one of the reasons why we wanted to develop this website, so that we can post some of the materials that we're seeing or that we're learning from employees. We envision one of the things that we want to put on this website is a bit of an annual report, where it's a synopsis of all the work that we've done in the current year, what we're seeing, and where we're going. So we're hoping through this communication implementation plan and some of the documents that we've developed to help guide us through this conversation, that will help be transparent, and it'll also help close that loop with frontline staff and with employees. Thank you.
Thank you. MLA Morgan, do you have a follow-up?
Thank you, and I do have a follow-up on that one. So when you talk about it will be continuous engagement, maybe you can explain what exactly can people expect? Does that continuous mean they'll hear from you again a year from now, or are they going to hear from you every month, or just in terms of what people should actually be expecting, what continuous means? But also, I mean, you talked about how you meet regularly, I forget if you said monthly, but with the project team, so that includes, health authority, leadership, and administrators. Is there space in those project team meetings for discussing some of the specific operational suggestions that might be coming to you that could be implemented in a shorter term? But I understand that it's not your job to implement operational changes or decisions, but it would be up to, the health authority. If someone's saying, hey, this could be done way more efficiently tomorrow, we just need to change this form or this protocol or something, and like, hey, that's a great idea, but instead of it just sort of going into the abyss of the analysis, it's like, hey, that could be done soon. Could that be discussed in your project team meetings, and is there any, accountability between the health authority and you guys in that meeting for them to say, yes, we're going to follow up on this, we're going to look into, we're going to communicate back to our staff who made that suggestion about how we could change this protocol? Can that be done within the confines of these project team meetings, or do you consider that outside, not our problem? The health authority can just decide on its own whether or not to take that suggestion, and you have nothing to do with it, kind of thing. Thank you, Madam Chair.
Okay. Premier?
Thank you. And the project team does work closely together. The Healthcare System Sustainability Unit does work with the Health Authority, and they do work with the Department of Health and Social Services. That's been mandated by myself and by Minister Semler that we understand we do have a number of different initiatives regarding sustainability. We have a number of different organizations, and we're not going to make any progress on anything unless we're all working together and regularly communicating. So Mr. Coutre can expand on that. Thank you.
Okay, Mr. Coutre?
Thanks, Madam Chair. And those project team meetings, they're really exactly about that. We bring the subject matter to that table for conversation, for review, both sides, whether it's our side or whether it's the health system that bringing ideas to that table. It's truly about collaborating and reviewing the ideas and the feedback that we're getting. But it's important to note, and I have to put another plug into the program evaluation approach, is that those conversations, we to the extent that we can, we really want it to be informed with data and evidence. So we need to gather that information and do that heavy lifting in advance to inform those conversations. But that's exactly what the project team table is really about. I think there was an earlier part of the question as well, Madam Chair, around feedback with frontline employees and how often that's going to happen. It's going to depend entirely on the program that we're reviewing. And if we're engaged in a certain program immediately, we're going to be engaging with the subject matter experts of that program at that time. And as we move on to other programs and services, we're going to shift our engagement to other subject matter experts who work in those areas. So that engagement is going to happen throughout the initiative over the next several months as we undertake this work. The other important communication tool that I want to throw out is we also have a monthly newsletter that we throw out to employees. And I really can't talk about communication enough. I mean, it was one of the risks that was flagged to us up front about making sure that we're circling back with employees, and we've worked really hard to make sure that we are doing as much as we can on that front. So I've set objectives for my group to make sure that we have a monthly newsletter out to employees. And we do that monthly, and it's just a simple update on what we're doing and where we're going. And sometimes it's really just that. It's just a short update. But other than that, we work as hard as we can to make sure that we're closing those communication gaps where we can. Thanks.
Thank you. Ms. Reid?
Thank you, Madam Chair. I want to expand on my colleague's line of questions just a slight bit. So when we talk about communicating back to frontline employees who are providing their feedback in this process, is there any contemplation of providing the context and why that decisions are made, and especially when they conflict with the information that employees are providing? Thank you, Madam Chair.
Okay. Okay. Premier?
Thank you. So if I understand the question, it's when decisions are made at the operational level, is there an explanation from those managers at that level on why they're implementing something? Is that correct?
Ms. Reid?
Thank you, Madam Chair. So just expanding on what I heard from Mr. Coudray, I'm curious if when that information is going out to frontline staff through email, through updates, is there some justification as to why certain decisions are made that way? Thank you.
Okay. So, thank you. Premier?
Thank you. So there's not really decisions being made. I mean, there's decisions about how to engage and what type of work is going to be undertaken and how to analyze information, but we're not implementing operational changes. We're not making decisions in that sense. So this is more, we're providing updates to the work that is ongoing, if that helps at all. Thank you.
Okay. Ms. Reid?
Yes, thank you, Madam Chair. And perhaps my question is better suited to the Minister of Health. But I'm hopeful that when we're collecting information from frontline staff, especially, that we are appropriately communicating why their feedback is or isn't being implemented in decision making. Thank you.
Thank you. Premier or Mr. Coudray?
Yeah, I can speak to that. So I think that's a conversation that staff need to have with their managers. That's where that relationship is. It's at the operational level, and I would suggest that that's where those conversations should be happening. Thank you.
Okay, thank you. Mr. MLA Morse?
Thank you. I won't even really structure this as a question, but just kind of to reemphasize and drive home the point that I really do think that based on what I'm seeing here, that we could very well be in the position of getting a bit ahead of ourselves in terms of analysis, assessment, and decision-making versus the system's ability to implement the changes that are being recommended. And I remember seeing this a lot at the city, and I'm seeing it happen at GNWT as well, and so I would just throw a plug in there that we might want to think about how implementation of this is going to work, should have worked already, and how we're going to create capacity within the system to implement change. Because it just seems to me like one of our biggest problems is that the system doesn't have that capacity. And that's one of the reasons we're seeing a number of recommendations pile up upon themselves. And that is something that can happen in a system like this, is that it's quite, although it's not easy, it is fairly easy to just make decisions. It's easy to make recommendations, but implementing those recommendations can sometimes take years, and it's hard for leaders to appreciate that. So I just want to put that plug in that I think for the system sustainability unit to be successful, and certainly for the recommendations that have already come and gone to be successful, we have to create capacity within the system that doesn't seem to exist now to change itself. And so I would just say that if we're not creating that capacity, we could end up doing a lot of work that we don't have the ability to implement. So you can respond to that if you like, but it's kind of a statement for now.
Premier?
Thank you. Yeah, the idea is not to add a bunch of work to the people who are already doing a lot of work and don't have the ability or the time to implement those changes. And I appreciate the member's comments. That's valuable insight that he's providing, and it does feel like a bit of a chicken and the egg scenario sometimes. So that's something that we'll keep in mind as we move forward. Thank you.
Thank you. MLA Atalaya, do you have a question?
Thank you. Question, yeah. How are You know, given that this is part of our priority for access to healthcare, and it's for all the residents of Northwest Territories and the smaller communities, how are they being represented in this healthcare sustainability unit? Thank you.
Premier?
Thank you, Madam Chair. And, that's something that's always at the front of mind, is access to healthcare in small communities. And even in a regional center like Hay River, we have difficulties. And so I always think about the smaller communities. Maybe I can get the Deputy Minister to speak to that. Thank you.
Okay, Mr. Coutre?
Thanks, Madam Chair. And as part of the engagement that we've done already, we've actually went out to this regional leadership within NTHSSA and got their input into the preliminary work that we're doing. It's also worth noting that we've also committed to reaching out to regional councils and making sure that they're kept abreast of the work that we're doing and giving them an opportunity to provide feedback. So that part hasn't happened yet, but that's still on our radar to make sure it happens. Yeah, thank you.
Okay. MLA Yakala? Okay, so if there's no more other set of questions, I just want to say that, meeting this morning with NWTMA and with Premier, it's all important. So I know that we are all in it together to sustain and improve the healthcare in the Northwest Territories. So I just want to say thank you to the Premier and his team for joining us. So this concludes the public briefing on Healthcare Sustainability Unit. Thank you.
Thank you.